has been affecting everyone, all of us, and of course, sanitation workers are at the heart of this challenge that we are facing, as they are one of the key players and frontline workers to help people in everywhere try and be safe from this pandemic through their work of cleaning the different type of sanitary work. So this has, of course, increased their vulnerabilities, and especially in some contexts where there's a poor support from governments and employers to provide safe working environment and appropriate equipment and gear. So today I'm glad to present my panelists for today. We have 5 of them, and they're from different research centers around the world. Today they will give us some insights about their work, research specifically, and different contexts. Today we have Ghana, India, and Bangladesh. So to kickstart, we'll start with Ms. Solomie. I hope I'm pronouncing the name correctly. And she's a researcher from the International Water Management Institute in Ghana. And today she's gonna talk to us about her research related to vacuum tankers operation during the pandemic. So I won't take long. I will welcome Solomie, and yeah, the floor is yours.
Yeah. Thank you, Maryam, for the introduction. I'm trying to share my screen now. I hope you see my screen.
Yes, it's there.
Okay, great.
And just a note, every speaker will have 5 minutes to talk, and then we'll try and leave more time for discussion.
Great. Yes, welcome to my presentation. This study was conducted to get an insight into sanitation service provision in the face of the pandemic. I'm a researcher at the International Water Management Institute based in Accra, Ghana. So Maryam has given a good introduction in terms of the attention that is being given to sanitation workers, where we have more attention towards health services, more attention to vaccine, more attention to lockdowns, but we haven't seen a lot of attention being given to sanitation workers. So we would like to know how the pandemic has affected them so that some policy recommendations will be made. Just to give you a little bit of a background on Ghana's sanitation situation. Well, as in many developing countries, majority or even more than 70% of the urban residents, they rely on shared sanitation facilities. This could be either compound toilets or public toilets. And most of the toilet facilities are on-site sanitation, which means they need emptying, transportation, and treatment. Only maybe 5% of the population is connected to sewer lines. And in terms of the service, municipalities together with private entities provide emptying services in the form of mechanical and manual collection. So in our study, we focused on emptying and transport. So I have this figure of sanitation service chain. We are not looking at access to toilet or treatment, just the emptying and transportation service providers, which we call as vacuum truck operators. So we interviewed about 60 vacuum truck operators from the Greater Accra region and the Northern region. And our key questions to them were how the pandemic has affected them, their operational activities, how it has affected them in terms of their revenue generation, and what measures they have put in place to make sure that practices are safe and to ensure that there is continuous service delivery. Now, in terms of the operational regulations, before the pandemic, under the baseline scenario, we asked them what operational regulations they follow from local authorities. Majority of them indicated that dislodging waste at designated dumping site and ensuring that there is no leakages were some of the key indicators that the service providers put as important, which are imposed by the local authorities as well. And you could see that wearing of safety gears like PPEs, personal protective equipments, at all times were only mentioned by 3% of the interviewed truck operators, which means safety is not their key priorities. People, the service providers, they wear different gears and there is no standardized gears. And in terms of their clients, the major clients are households, public toilets, and institutions in that order. And business operation pre-COVID-19, in terms of the households they serve and the fees charged, on average, these vacuum truck operators, they serve about 32 households and 16 public toilets, and institutions are less. And in terms of how they charge the fees, it depends on the distance, volume of septic tank, and the client they serve. And the average hauling distance is about 14 kilometers. And the way these transactions are done is, that is mode of payment. Figure 3 on your right shows how the payments are made or transactions are made. Majority of them, they prefer and they also use cash payment and mobile money. Especially mobile money is very important in the face of the pandemic with less cash exchange, as it reduces transmission as well. So they also prefer that, which was a good thing in Ghana, given that mobile money is very common for the day-to-day transactions of different economic sectors. Now, during the pandemic, we asked them how their measures have changed in terms of their safety measures and so on. And the blue lines are pre-COVID and the orange lines are post-COVID, or actually during COVID, not post. We are still in the pandemic. So observing COVID protocol is a new indicator that they have put in place. Safety has increased in terms of the importance compared to pre-COVID, but in terms of using PPE gears, there is no standardized using of PPEs, although the use of PPE has increased during the pandemic across all the service providers, but it depends on the behaviors of the service providers in terms of what kind of gear they would like to use. So there was no regulation or whatsoever. And how has COVID affected their business operation? In terms of the number of clients served and the fees charged, there has been a reduction in both, which resulted in reduction of revenue generation and income earning. So for households, public toilets, and institutions, especially in Accra, which is the capital city of the country, and it's also in the greater Accra region, on average, there is a reduction in the number of clients by 20% in households, 24% in public toilets, and 29% in institutions. Especially during the lockdown, there has been a major reduction in institutions' clients. And in terms of the fees charged, there is a reduction in fee on average of 19% across all clients. But in the other region, which is the northern region, the capital is called Tamale. Although there were a reduction in the number of clients served, there was no change in fees charged to different clients. So it depends from region to region how the pandemic has affected on the operations of those service providers. Now, we also asked them what are the operational challenges they face, both pre and during the pandemic. Although they had a long list of challenges without the pandemic has also compounded those challenges. So, for example, on the left side of the table, you could see the operational challenges they faced during pre-COVID-19. For example, poor road network, police hostility, no incentive mechanisms from the government, and so on, and lack of PPEs to clean septic tanks effectively. And during the pandemic, in addition to those were still there. In addition to those, they also faced reduction in number of clients and difficulty of customers to pay their fees. And there were also conflict with clients because now clients started to make bargains for the fees. Previously, it was more standardized. There was no question asked. They just based it on distance and the size of the septic tank they were charged. But now clients started to make bargains to reduce, and this has created conflict, even conflict between owners and drivers of the trucks. In Ghana, most of the truck drivers are not necessarily owners, so they are employees. They are paid based on the daily client served. And this has created some problems between drivers and the truck operators as well. And police hostility during lockdown has also been mentioned a lot of times. And I think this has to do also with the trucks, which are very old, and sometimes they leak, and police are very hostile towards the sanitation service providers, and they are not also professionalized. They are looked at not in a good way. So this has to change. Also, some policies are being implemented now. And in terms of public support, the surveyed truck operators indicated that they never received anything in terms of public support during the pandemic. And only 16% indicated that they received some form of training on safe and effective service delivery during the pandemic. So they have been neglected during the pandemic, and no attention has been given to them. Now, in conclusion, the major impact of the pandemic has been a reduction in revenue generation and income due to reduced number of clients as well as reduced fees. And payment mode for service during the pandemic has been electronic payment. This has been a positive thing about having an electronic system where there's no cash transaction, and this has to be encouraged. So it's highly recommended that one of the possible means of curtailing the spread of COVID-19 is through mobile money or electronic payment modes. There is a need for professionalization of vacuum truck operators. This is really important, especially so that people also look at them in a positive way. The perception now is that they are not looked at, especially by the police and all. They have been subjected to different police hostilities. So use of personal protective equipment while eating is subject to the behavior of service providers. So I think we are recommending that the government should provide support both in terms of awareness creation about the importance of the PPE and some kind of support so that all sanitation service providers wear a standardized kind of PPE so that they are professionalized. Need for training on service provision and coping mechanisms in the face of the pandemic is very important. With that, I conclude my presentation. Thank you.
Thanks, Solomie. This is really insightful. I guess it gives us more insights, not only about the health challenges of working during a pandemic, but also to the financial insecurities of this job and how the lack of financial and health insurance are a key challenge and a key barrier for their job security in general in Ghana as well in so many other contexts. Thanks a lot. Please, everyone, if you have any questions for Solomie, feel free to put it on the chat box, and we'll get to it at the end after all our presenters finish. Up next, we have Mahboob Alam, and he's quite a friend and a colleague of mine as well, and he works at the health research center in Bangladesh, ICDDR, in collaboration with ITN-BUET, and today he's going to present to us a study in relation to the key occupational health and safety challenges faced by waste and sanitation workers during the pandemic in several cities in Bangladesh. Mahbub, please feel free.
Hi, Maryam. Thank you for the introduction. And can you see my slides?
Yes, all good.
Okay, so I am from Bangladesh, and I am working as an associate scientist at ICDDR'B. So in collaboration with ITN-BUET, we conducted one study, and I will go through that study within 5 to 6 minutes. So we all know that sanitation workers have multiple occupational health risks, which increased further during the COVID situation. So ITN-BUET and CWIS support cell, which is the government authority, so provided an intervention consisting of training, personal protective equipment distribution, and with practical demonstration how to use those PPE. So we conducted a before-after control intervention study to understand the impact of the intervention in improving the occupational health safety of the workers. We had 7 areas as intervention and 3 areas as control. Can someone confirm me that you can hear me?
Yes, Mahbub, all is, yeah, hear you very well.
Okay, so it seems that the screen is freezed. So okay, I'm carry on. So this is the data collection methods and actually sample number from our evaluation study. So we focused on both quantitative and qualitative, and we conducted survey of around 500 frontline workers during baseline and inline. We conducted structured observation around 50, both during baseline and inline. And for qualitative data collection method, we used key informant interviews, in-depth interviews, and we prepared some case studies. So I will talk about the quantitative results here and mainly focused on structured observation and survey. So you can see that we have presented the results in difference. Uh, so we have found that availability of safety guidelines to the workers increased by 57% after the intervention. And there is an increase of 32% of PPE availability among workers. 29% of the workers knows how the COVID transmission occurs. So the knowledge increased, and they have also increased knowledge of preventing the transmission actually. Workers understand the importance of using PPE, which increased by 39% after the intervention, and they also understand the importance of washing PPE after use. So it's also increased by 21%. Workers also understand the importance of cleaning their tools, which increased by 19%. We have also asked the workers and observed them whether they clean and change their mask every day, which is reusable. So we have found that in the intervention area, there is an improvement of 53%. Workers clean working equipment regularly, which is their equipment and tools. So we have found that there is a 29% increase in intervention area. And workers wear PPE while cleaning waste vehicle every day. We have found that also increased by 28%. Workers also try to save their family members from infections, so they took necessary safety precautions after returning home, which increased by 36%. And they properly disposed used PPE, which is 23%. So based on our results, especially quantitative results and from other qualitative results, we have prepared the recommendations to the government and ITN-BUET. So we recommended that organize a refresher training for workers and their supervisors at least once a year on maintaining occupational health and safety among the workers. We have to make a balance between quality and comfort to ensure durability and use of PPEs in the future and create a mechanism that will maintain an inadequate supply of the PPEs once those get damaged, because some workers complain that those are not good in quality sometimes. The city authorities need to enhance their capacity to identify PPE requirements based on the need and the demand of the different types of workers. And also gender consideration is essential while distributing PPEs. Workers should be encouraged and made responsible to use PPEs on regular basis through on-job training and supervision. We have also recommended that a detailed study and intervention should be considered to further address the occupational health safety problems of the workers holistically, that include improved salary structure, stable job contract, decent workplace, insurance facilities, medical facilities, better education and training facilities, improved accommodation, wash access, and proper protective equipment. Thank you all. So looking forward to your questions.
Thanks, Mahbub. Yes, definitely really insightful observations from Bangladesh. And yeah, I would really like to discuss further what are the expectations and what are the preferences in terms of the types of PPEs used. So yeah, we'll be really excited to discuss this after our presenters finish. Up next we have Tripti from the Center for Policy Research in New Delhi, India. They will talk us about the sanitation workers' condition during the COVID-19, specifically related to social aspect, occupational and residential vulnerabilities during this pandemic in 10 cities in India. So yeah, Tripti, please do share.
Hi, I'll just share my screen.
Yes, great.
Okay, hope you're able to see my screen.
Yes, all good.
Okay, great. So I'm Tripti from Center for Policy Research in India, and we had rolled out this study in 10 cities in India during the lockdown period in 2020. And I'll be presenting the findings from these studies, mostly focusing on social occupational vulnerabilities that sanitation workers faced. And this is based on a qualitative field study that we carried out. It was a rapid study. So just before we dive into the insights, I want to lay the context of sanitation workers' issues and challenges that exist in India. So before COVID-19 came in, sanitation workers already work in unsafe work environment. They are exposed to risks at work. There are studies to say that about 5 million sanitation workers either work in full-time or part-time work. There are about 2 million people who are working in high-risk working conditions. And recently there's been an increase in death of sanitation workers, especially working in sewers and septic tanks. There are data to suggest that one death in sewers takes place every 5 days in India. So these numbers are stark, and these are numbers from 2018. So after after the outbreak of COVID, these risks were likely to increase. So we had rapidly launched this study in 2020 to delve deeper into these risks that sanitation workers faced, especially after COVID. So the methodology that we had adopted was of using qualitative insights, field insights, and we'd conducted 17 in-depth interviews across 10 cities where our researchers were based. And while this study was being rolled out, there were some responses that the government had already made to protect frontline workers, including sanitation workers at that point. Financial Minister had announced medical insurance cover 50 lakhs. There were schemes to say that, like for Delhi, for instance, there was this announcement of ₹1 crore insurance for health workers, also for sanitation workers. And I think about two days ago, one of the sanitation worker also received, the deceased member of the sanitation worker also received that payment. But there were these initiatives, like Punjab government had this 50 lakh announcement for sanitation workers to cover them, but these were to protect them in case of a mishap. They were not protectionist in a way. They were like, if something goes wrong, if they lose their life due to COVID, then there would be a cover for the family members. So keeping all of it in the background, we had sort of rolled out the study to understand the nature of the contract of the workers, what implication it has on the sanitation workers, protection, especially from a social protection perspective, the procedure of work and the working condition that they have, the access to protective care. So these were some of the key questions we explored during the study. The field insights that we have from different studies, from different cities, highlight variations within cities, and also within there are variations based on different contracts that they have. So if there was a permanent municipal sanitation worker in Orissa, they said that they don't have access to many protective care, but they have access to, like, say, a fluorescent jacket, or at times even boots. But many protective gears they do not have access to while engaging in sanitation work. Sanitation workers engaged by or employed by NGOs, they reveal that they do not have access to sanitation and hand washing facility during working hours. Sanitation worker employed by RWA highlighted that they were told to sort of sanitize the whole campus where they were working after a resident had tested positive. And these were some of the initial fears that people were facing. So when COVID had just broken, and it was March 2020, and it had sort of just sporadically spread all over. So there was a lot of fear, but India was not ready to deal with the COVID, but also it was not able to sort of prepare its workers to undertake these protective measures in a safe working environment. So the workers that we interviewed, I mean, we were able to sort of categorize them into three different categories. So there were these workers that were employed directly by the ULB, urban local body. So these were government bodies, so permanent municipal sanitation worker, for instance, permanent sanitation worker employed by private firm contracted by ULB. And their vulnerability sort of varied as they were, if they were employed by ULB, then they had more access to better social protection vis-a-vis workers that were employed through intermediaries or through market-based. Actually, those employed by market, say, a private contractor or an unlicensed sanitation worker, these had least amount of social protection and least amount of access to personal protective equipment. So these were some of the major findings that the study highlights. So some of the key takeaways from the study include that sanitation workers work in precarious working condition, they lack access to wash at workplace, there's lack of clarity in terms of engagement and the payment schedule, and there's limited access to safety nets. Non-permanent workers are threatened with layoffs, and there's delay in payment of salaries. So yeah, so I'm happy to take any questions in the next round. Thanks.
Thanks, Tripti. Really, really provocative, I think, notes from about the current support that they receive from the government, the compensation. If this is really something to discuss after other presenters finish their work. So yeah, really excited to have this discussion afterwards. Up next, we have our fourth presenter, Mr. Siddharth, a sanitation worker representative, union leader from India, and he's going to talk us about their experience in implementing the Prohibition of Employment of Manual Scavengers and their Rehabilitation Act during 2013. So yeah, hopefully there will be some insights about this experience during the COVID as well. Siddharth, please do.
Thank you. I hope I'm audible.
Yes, you are.
In the last presentation, I think the categories of workers, I couldn't see a category called manual scavengers. So manual scavengers are those who engage in handling or disposal of human excreta in undecomposed form, which involves human touch. So it doesn't involve using any kind of equipment. In 2013, Indian Parliament had passed a law prohibiting this practice because it is considered to be against human dignity. And those who engage in this occupation are largely comes from what is called the Dalit communities in India. They are the communities who had historically faced the practice of untouchability, and even now they continue to face this practice of untouchability. I'll speak. I'm not a researcher actually. I'm not speaking out of any research that we have conducted. We have a union in Karnataka, in the state of Karnataka in India, uh, which is a union of workers who engage in this practice of who continue to engage in this practice of manual scavenging. I work in the city of Bengaluru, and most of what I'm going to share comes from discussions with the workers in Bangalore. In the initial, I mean, I'm not going to talk in general about the implementation of the act. I'll stick to the topic at hand about what has happened in the last 2 years of this COVID pandemic. Just to give a brief idea of the context in which this work is happening, the city of Bangalore has a population. Current population will be around, I think, 12 to 15 million. In the last census, which was conducted in 2011, about 10 years back, the population of the city was about 8.5 million. There are about 2 million households in Bangalore, of which about 80% are connected to sewer lines. Rest of the households are connected to either septic tanks or pits, single pits. So these are essentially like cement pits into which excreta flows into from the toilets. And this is cleaning of these pits is the forms a major chunk of what is manual scavenging. Most of the manual scavengers in the city of Bangalore actually are engaged in manual cleaning of these pits. It's not like there is no the availability of machinery is not a problem. Apart from the workers who do this manually or using bamboo sticks or some other very primitive sort of equipment, there are the local government agency, the parastatal body which is in charge of the sanitation function in the city of Bangalore. They have about 120 to 150 vacuum suction pumps. So these are 150 machines for a population of about 150 15 million possibly now, because the census has not been conducted, so we don't know the exact number. About 15 million population, there are about 150 machines with the government. Apart from that, there is a thriving private market of these machines. So the workers who are doing this work manually are basically competing for their livelihood with the private players as well as the government services, which are sanitation services through vacuum pumps. Now, why are they even doing this work? Because the reason is that till about 7 to 8 years back, there were no machines. Most of the cleaning was being done by workers themselves. In 2013, when the law was brought, the government was immediately supposed to do two things. One is to ensure that nobody engages in the cleaning occupation manually. Hence, technology was to be introduced, and alongside that, all the people who are doing this work were supposed to be identified and rehabilitated, basically given alternative occupations, so that they are not forced to engage in this occupation. The part of rehabilitation has not happened at all, and this was one of the biggest challenges we faced during the COVID time, because we have been fighting for rehabilitation of people for the last about 5-6 years, and that process was gaining pace. There was a High Court PIL also pending, which has given some good orders, and we were in the process of implementing this when the COVID thing happens. And immediately the response from the government was to just stop all the rehabilitation activities, and we have been sort of setback. We've had a setback of about 2 years in that process, and now because there was no rehabilitation from the government side, the workers were in a very desperate situation, because of the lockdown they couldn't travel to do this work, and on the other hand there were no support from the government. So they were really in very desperate situations, and many of the times they were engaging in very risky form of this work, going inside the pits and going inside the manholes and all, because the situation was so desperate that whatever work came their way, they were engaging in it. Those are the two most biggest challenges that we face, that we couldn't get the government to rehabilitate, do anything for this category of workers. While the other workers of the government had like some, they are recognized as government workers, so there is some support from the government in terms of health insurance or I mean food support, ration support and all. But these workers, because they are not recognized and they're not supposed to exist because the practice has been banned. Uh, because of this, government is not willing to do anything for this category of workers. So the workers went through a very disturbing time in the last 2 years. Um, in terms of opportunity, I mean, there's not much that one can say in terms of opportunity. As I said earlier, this is a caste-based occupation. For example, there's a study conducted in 2020, and which found that about 93% of those who engage in this work come from the Dalit communities, and specifically, this is in Karnataka. Specifically, 74% of them come from just one Dalit community called Madigas in Karnataka. So this is a very caste-based occupation, and only Dalits are supposed to engage in this particular form of cleaning, because the other castes considered it polluting to come in contact with what are called dirty things, including excreta and leather and dead bodies and so on and so forth. In terms of, I mean, I won't call it an opportunity, but sort of a very tentative opening is that because of the lockdown, because the workers couldn't come in, or people didn't want workers to come inside their houses, the usage of the machines, whether it's privately operated or government operated, increased to some extent. There are actually people who don't want to call machines. They prefer that somebody comes and with hand they clean their pits and all. That practice declined temporarily in the last 2 years. People started calling the private operators of the government vacuum trucks. Whether this is a transitory phenomenon or people go back to their usual way of things, we don't know. So it's the, I mean, slight opening in terms of shift in behavior. But of course, in the absence of rehabilitation for the workers, they are in a very bad situation, because people not calling them means loss of livelihood for them. Absence of rehabilitation means no alternative livelihood for them. So they are in a very difficult situation, and we're hoping that now things will start moving once.
Thank you.
I mean,
Thank
now that
you,
COVID is
Siddharth.
done. So
Sorry, I
that's,
have to cut you. I've been running a little bit over time, but thank you so much. Really, really great insights. And yeah, I totally agree. The manual scavenging is continue to be ignored. No one wants to talk about its existence. So no one is trying to tackle this. I know that it's prohibited in so many countries, but in reality, it's still there. In papers, it's prohibited, but we continue to do this, and which I think it's more frustrating than other types, because it's an ignored issue now. So thanks a lot from the insights that you gave us from India. The last speaker for us today is just let me do that share screen thing. So the last speaker today is Miss Leela. She's a researcher from the National Institute of Urban Affairs in India, and she's going to talk about the emergency of COVID-19 response in different areas in India, and specifically the urban context. So yes.
Thank you, Maryam, and I'm sorry I can't share my video.
No worries.
Yeah. I was actually traveling for a field visit, and the network is quite bad here.
Thank you for joining
so,
us. So yeah, pleased to have you.
Same here. So I'll be talking about.
Maryam, sorry, Maryam, we can see the presenter's view. We can't see the full slides.
Okay, let me see how I can do this.
You just have to do a slideshow.
On the display settings on top?
Yes.
The arrow, yeah.
This one.
Yes.
Yeah. Oh, sorry about that. All right,
Yeah,
Leela,
perfect,
please go on.
Yes, so I'll be talking about a toolkit that our team had developed during the COVID for PPE equipments of sanitation workers in Uttarakhand, which is a state in India. So let me just give you a brief context about the urban population here. It's 30.5 lakhs of population with an urbanization rate of 30.2%. And when we were doing the study, we came to know that there are around 18,200 number of sanitation workers across the state in the urban context, which included people doing door-to-door services, working at the STPs, desludging operators, street sweepers, etc. Next. So while we were doing the study, we came across the different kinds of impacts that were being put on the sanitation workers because of pandemic, and these were some were direct impacts and some were indirect impacts. Direct impacts like there were a lack of safety nets, which is why we developed this toolkit. Then the nature of employment, which is mostly informal in the Indian urban context. Social insecurities, gender issues, and other risks like long working hours, fatigue, and occupational burnouts, etc. Next. So based on the direct and indirect impacts, we came up with a need for the sanitation safety response for these sanitation workers. And we came down to activity-wise risk involved in each activity. For example, when we saw door-to-door waste collectors, the major risk that was involved in their occupation was they would be coming in contact with the infected person if they do not have proper PPE kits. Next. We developed a sanitation workers safety risk matrix in which we categorize them from very high risk, moderate risk to low risk activities. For example, very high risk were those were sanitary workers working in hospitals or quarantine centers. Then in the moderate risk it was door-to-door collectors, and in the low risk zone it was street sweepers, because they're not coming in contact with the the mask and everything that was being disposed of in the quarantine period. Next, there is this priority task and actions which we gave to the state, and they could prioritize actions according to their priorities in each urban local body, and take up activities in such matter. Next. So the time of COVID-19 is a time when the demand was very high for protective gears. And so for budgeting, the state or town must prioritize the categories of workers who require to use these protective gears, and also category-wise required for protective gears. So the government of India and various state governments have detailed out essential protective gears, and this needs to be factored in the budget making process. Some civil organizations also possesses expertise in the areas of sanitation and have also drafted documents highlighting the need for protective gears. In our document, we have not only gone for essential protective gears, but also some which might be case specific. Next. So as I was talking about the template that we had developed for procuring protective gears, so I'm just I'll just throw some light through one of our urban local body, which as an example, which is Devprayag, with a population of 5,000 in their urban local vicinity, and the budget estimated was for a duration of 6 months. So we had developed a template, and they just needed to fill in the essential details. Next. The step 1 included only the basic details of the urban local body, etc. In step 2, we have given several categories of what kind of sanitary worker is involved and what kind of protective gear is required. And based on the type of worker relevant to the urban local body and the number of workers, they can place the quantity of the type of protective gears in this table. Next. In the step 3 and step 4 also, we have listed out some of the consumables which were really important in at that point of time in the pandemic era for the sanitary workers. And there were several other indicators as also, like for example, for mask, one can go for a single use surgical mask or multiple N95 masks, and we had given this the rates were to be finalized from the GEM portal, and these were certified, and we had also included certified PPE manufacturers in the document. So the total budget that came up for a small city like of 5,000 was around 6.47 lakhs for the sanitary workers, and the state had taken up this template and also trained the urban local officials, and it has helped them procure some PPE during COVID, and I'll share the link to the document in the chat box. Thank you.
Thanks, Leela. This is really helpful. I think very, very interesting tool that can be adapted during the COVID, but also afterwards. So yeah, really, really thanks for this presentation. We're now finished with the panelists. So please, if you do have any question for any one of them or for all of them, please put it on the chat, or you can raise your hand to ask any question. In the meantime, I do have one question for our first presenter, Solomie. I hope I don't put you under the spotlight, but I really wanted to know more about the service providers. So you mentioned that the standards of occupational health provision, such as PPE, and the standards related to PPEs is determined by the service provider. Can you explain more how come that the service providers do not commit to a specific standard, and were there any policies or any interventions from the government that help service providers or gave instructions for the service providers to commit to specific standards to ensure the safety of the workers?
Yeah, thank you, Maryam. Well, this septic truck operators, most of them are private operators, and most of them, the trucks are owned by a company, and the drivers are hired by those companies. So in terms of operational regulations, the government has a list of regulations, but they are not adhered to. Even when people come to our houses, when they collect our waste, you see them, some of them, they don't even wear the gloves, basic thing. They just touch the garbage bin and take it out. And the same with the emptying of septic tanks. And it depends on the behavior of the individual. So if the individual believes that it's important to use PPEs, they will wear it. But it's not like the government is imposing or enforcing the law, because the law is there. But what is lacking is mostly in the sanitation sector, not only with the liquid waste, but even with the solid waste, the way it is collected and all. It's the enforcement of the law. So what we recommend, we presented this to the local government and to the municipalities and so on, that they have to make it mandatory that all the truck operators use similar PPEs, standardized PPEs. But there is a question of budget, who pays for those PPEs. So we were recommending that some kind of partial financing of those PPEs to encourage those service providers to use them. So it's more of not being able to enforce the law rather than the law is there. Yeah.
Okay. Thanks, Solomie. One last point that you mentioned about the fact there's no change of fees during the pandemic. And my question is, I would expect that the sanitation workers are frustrated with this. Were there any potential for any sort of union work that can advocate for the sanitation workers' right to increase the salaries, especially as there's less jobs, as you mentioned? Are there less trucks to more limited jobs during the pandemic? So was there any sort of movement or union union advocacy toward the sanitation workers' rights?
Well, these septic truck operators are, most of them are members of an association. There are associations. So the association has their own ways of addressing or mitigating some of these risks. They have a welfare association where they put money every month or whatever. And when there is some problem with their members, they try to help it. It's more internal within the association. But in terms of advocating for fees, the fee is set by the assembly. So the union, the association negotiate with the assembly in terms of how the fees are set. But with the pandemic, we haven't seen any support from the government whatsoever. That's what they also indicated. So there was no training, no any kind of financial support in terms of even to get money to buy some PPEs as a loan or financing schemes. There is none. So they are on their own. They just follow their own rules, and each association is different. They have their more or less rules that they follow, but not to our knowledge. There was none. Yeah.
Thanks, Solomie. Thanks again for the insights from Ghana. Really interesting to hear more about this. A second question to our second panelist, Mahbub from Bangladesh. So you mentioned that there's one of your recommendations were a more suitable BP. If you can explore this more, what are the characteristics related to appropriate PPE? What people do prefer in terms of the standards, or what are the negative aspects of the current PPEs that people use at the moment and supplied by the government and BUET?
Thanks, Maryam. So CWIS support cell and ITN-BUET tried to provide the best quality PPE, which is like maybe the gum boots and other like aprons, which are heavy and like thick. So what happened in Bangladesh, like it's hot and humid weather make it difficult to use them for long hours. Like if workers use those for half an hour, they become tired due to sweat, and like boots are heavy, so it's difficult to walk. So they requested or suggested to provide or prepare some kinds of boots which are sustainable, which are good in quality, but not heavy. I mean, not the weight is not too much. In terms of like other PPEs, like their aprons and like helmets, they suggested something like that this should be sustainable, this should be good in quality, but we cannot carry the weight of those PPEs like boots and other things. So that's the recommendation from the field.
Thanks, Mahbub. Yes, yeah, definitely agree. I've been to Bangladesh and I noticed the weather is quite humid, and yeah, that the gear that NGOs and government provide is quite not suitable for this type of weather. But it keeps frustrating me to see this over and over happening, that the same type of heavy gear is always adapted and always used in any context, regardless of the weather or the people preferences as well. Thanks, Mahbub. Siddharth has put on the chat a film about manual scavenging in Bangalore. So if anyone wants to look at it now or afterwards. I have one question for Siddharth, our third panelist, our fourth panelist. Sorry. We've talked about the Rehabilitation Act. I was wondering, what are the steps used to increase their employability? What are the potential to shift to a new job? Are there any organizations in Bangalore that offers training for them? And if so, is the context there allows, is the taboo there still connected if you left the job? So for example, in Bangladesh, when I've talked to some of sanitation workers, they mentioned that they tried to switch jobs, but they couldn't because people keep relating them to their old job, and therefore they don't welcome them in any really sort type of dignified job. So yeah, if you can give us insight about this.
So there are two aspects to the question that you have raised. One is in terms of whether there is any organization which gives skill enhancement training for alternative occupation. There are several organizations, both governmental and non-governmental organization. The way it's supposed to work, the rehabilitation process is that the moment you are identified by the government as somebody who has been engaging as a manual scavenger, you are supposed to be given a one-time cash assistance so that you immediately leave this work, and this is for your sustenance for the next 2-3 months. Then you have to identify what alternative occupation you want to be in, and then the government is supposed to arrange the relevant training for that occupation. In the meantime, any financial assistance required needs to be arranged, and then the person can start that work. That's how it's supposed to work. The Karnataka government has a skill development department which provides several, range of such trainings and placements as well, beginning from electrician, plumber, taxi driving, all sorts of things are there. The second question that you raised in the Bangladesh context, you were saying that people know that this is somebody who is to do this work, and then they won't. Then the possibility to shifting to something else is very little. That happens. That thing is little less in Bangalore because you can always go into a different area and do it where people don't recognize you. But in the rural context, it happens that people know you as somebody who has been doing this work, and then if you start say a tea shop, nobody will take tea from you, and there the option is not to do this work in your own area and go to the district town or nearby town and do there where some anonymity is possible. I just give one small example to end this. There was this one person who is still waiting for rehabilitation from the government. He used to clean these pits in Kolar districts, and in all the villages that he used to go and do this work, he used to be known as Pit Narayan Swami because he used to clean pits. And then he got this 40,000 rupees, which is not actually rehabilitation, which is just for you to leave this thing and manage for a certain period. So he took that 40,000 rupees, INR 40,000. Some of it he had some debts he cleared with that, and with about 25-30,000 rupees, he bought a second-hand two-wheeler and some aluminium vessels. And he used to go in the same villages and sell those aluminium vessels. Initially, he found it very difficult. Over a period of time, people started buying this thing, and now in those villages, is known as Steel Narayan Swami because people think those vessels are steel vessels. So he's known as people call him Steel Narayan Swami. So it happens. It takes some time, but over a period of time, that change does happen. We have seen that happening. But if the same person would have started say a tea stall in his own village, he would have never been able to make ends meet. So there is limitation, but there are options to sort of cross this. Thanks.
Thanks, Siddharth. It's refreshing to see that there's a sort of pathways after moving from this job. Yeah, and hopefully in the coming years this become less of a taboo topic and people become more open to work and collaborate with sanitation workers. So thank you. My next question is for Tripti. You mentioned a very, I don't know, provocative point about the fact that the government offered some sort of financial aid, and at the beginning I was surprised and happy to see this actually the case, but then it appears that it's a payment that they give to the families of sanitation workers if they passed away during the pandemic. So can you explain to me if this actually happened at some point, and how are people reacting toward this, and whether there was any advocacy or any pushing toward having actual financial insurance during the lives of the sanitation workers and not after they pass away?
Sure. So basically, the way it played out in India is that sanitation workers were also provided medical coverage. And these were sort of sporadically announced when COVID broke out. So permanent sanitation workers are better covered. They would have permanent sanitation workers that are engaged by the government. They would have better sanitation, so access to social protection, right? They would have access to, say, maternity benefit. They would have access to paid leaves. But most of the sanitation work happens through the informal sector. So they're either contracted by a private contractor, or whether they're engaged through an RWA, or so they're these intermediaries, right? Like the RWA and all, and they don't have access to social protection when they're employed through these intermediaries. So when the government one of the ways to sort of protect these sanitation workers when COVID struck was that it announced these packages for sanitation workers, but these were mostly for sanitation workers that were permanently employed by the government, ULB, urban local bodies. Those that were not engaged by the urban local bodies, they could not even access these benefits. Even the national level insurance, or the coverage that the state had announced for the deceased, the frontline warrior, right? If they passed away or they suffered injury, they could not access those benefits either. So one was that, this was after they actually died, when they were no longer there, the families could benefit it. Actually, 2 days ago in Delhi, one of the lady sanitation worker, her family did receive 1 crore. So it did meet the headlines. But these are a few cases. They are not many of those in any case. And this is problematic in its being anyway, right? The social protection is reduced to and that too very limitedly available for few sanitation workers. Also, like Siddharth was saying, like the OTCA, right? The one-time cash assistance that's offered to manual scavengers. It's a one-time payment of 40,000 rupees, 40,000 INR, which is a very small amount, and it's only to sort of get them to leave the job, but it doesn't offer that sustainability. So there are these gaps around it.
Yeah, thanks for the answer. Definitely frustrating to see how it sort of became normal to hear about deaths. I know it's been there for ages, but only captured the international and the top news, as you mentioned, just lately. And of course, we need more time to challenge this and put more pressure against governments to take responsibility. Thanks, Tripti, again for the presentation. It was great. A last question for Leila. So you presented a very detailed and unique exercise for estimating the costs and quantities of PPEs. Did your study took into consideration the preferences of sanitation workers in terms of the type of the PPE, and if yes, what are these gear? If you can describe more.
Like I was talking about the essential PPE requirements. Those were the PPE equipments that are like say some government body or a research institute have stated such essential items, but we have also mentioned some desired items, and I have actually put a link for the same. You can find all the details in the document itself. We have actually made a collective research book on COVID, which included this toolkit. So you can have a look at the link, and I guess your answers will be.
Okay. Thanks, Leila. One follow-up question is about the fact that you did this exercise for a small town in India. How would you imagine this would be different in terms of acceptance or the willingness of the government to do this if it's a bigger city?
So we have not done it for a small town. We have made a toolkit which can be applied to a small town also, and a bigger metropolitan city. Like for example, in case of Uttarakhand, we have also given an example of Dehradun. So the toolkit doesn't limit itself to a small town or a small city. It's just we gave an example of a city because we had trained the officials of the same city
Okay.
on this.
So you think policy-wise, not technical-wise, how the government changes, or the behavior of governments, or changes when it's a small city or a bigger city? I'm not sure if I'm making myself clear with the question.
No, it is correct. When we calculate for a smaller city, the sum that comes up is not a lot, and so the government is willing to sponsor such items. But if we show them a template for a bigger city, and the budget comes up to some crores, so they are mostly not interested in investing so much for sanitation workers, to be honest. So, yes, it does vary according to the city size,
Yes.
in case of Uttarakhand at least.
Thanks, Leela. This is definitely helpful. I'm looking forward to hear more about its applications in different places in India and potentially neighboring countries as well. I do finish my questions for the panelists. So if anyone have a question, please do raise it to and talk directly to the panelists. If I will wait for like 1 minute to see if there's any question pops up. There's one hand raising, so please. I can't see.
Yeah, it's me, Purva.
Yeah, Purva.
Yeah.
Sorry, I can't see it. Yes, Purva,
That's
please go
fine.
on.
Yeah, so this is more of a question to the panelist from India, not specifically to any one of them, but largely anyone could answer this. So after, like Siddharth mentioned, that after 2014, when the Manual Scavenging Act which prohibits manual scavenging, there has been this sort of push from the government to not recognize that this is manual scavenging. So then a lot of invisibilization is happening because of the prohibition also. So during COVID, how did that sort of get tackled, or was it very difficult for any advocacy or other work where to make government recognize that yes, even if you don't want to acknowledge this, there has been a lot of manual scavenging which is already happening. So when you did surveys with the sanitation workers, did you hear anything about this, or was it pushed under the carpet more? Are there any thoughts on that?
Yeah, shall I take a minute to answer that?
Yes, please.
I don't know if it's linked to the COVID scenario per se, but at the level of the central government, this is through internal sources that there's a push to declare India manual scavenging free, and so that has created a lot of problems because here at Karnataka we had directions from the High Court to conduct a survey of manual scavengers, and in Bangalore, through efforts of multiple organizations, we have been able to identify 1,400 workers, while previously this number stood at only 200. And at the level of state government, everything was done and it was sent to the central government, and central government said that who are these people? We can't recognize them. We are about to, this was supposed to happen on October 2nd, the declaration of India as manual scavenging free. And they were like, you're sending all this now, and how can we recognize all these people? So this according to the act, this is supposed to happen within 15 days. The list was sent to the central government on March of this year and still pending. The government has still not approved that list. Even though central government actually doesn't have any power to either accept or reject these things. So this denial of the problem and the scale of the problem plays out in a way where even after a very long drawn process of about 2 years of survey, and now is stuck at the central government because of this the attitude that they've taken, saying we are almost there in terms of being manual scavenging free.
Yeah, to be honest, this is also seen in a lot of other sanitation initiatives like declaring open defecation free cities, or like all of that, where cities are not really open defecation free, but you want to declare it. So you deny the whole issue of, you don't recognize basically, and which is a bigger issue. I mean, on the other hand, that you're not recognizing it. So you're keeping, or you're making the tools in a way, or you're putting those tools in process which will, I mean, which will not help recognize, which is all the more scary. Yeah.
Just one comment on this Swachh Bharat Abhiyan. So there is the second part of it where the mission has been extended to include solid and liquid waste management now. And like just the stark difference between constructing the toilet and then putting in mechanisms to maintain them, where there is funding for building toilets, there is like targets, there is a mission mode approach, and then the part of disposal and cleaning and all that is just left to, there are no targets, there is no funding, there's no budget, there's no mission mode approach. And so I mean, that's largely because, you know, the workers who do this come from marginalized communities, and so nobody really cares about who cleans the excreta. I mean, as long as there is toilet, it's fine. Like, who cleans it, nobody never asks.
Yeah.
Also, just to add to that, so the government is sort of taking these steps, right, to sort of very categorically differentiate between manual scavengers and say core sanitation workers, or like workers engaged in mechanical cleaning, but with personal protective equipment, right? And of late, especially after there's a push towards like, you know, more construction of on-site sanitation systems, of course, there are more deaths also that's happening. So if you see, it's sort of increasing, but they're trying to push for, like, you know, if it's people are using protective equipment, or if they're using protective gears, then, I mean, they're not manual scavengers. They're very categorically differentiated from like manual scavengers in that sense. But their access to these gears and their access to these equipment sort of varies based on the type of based on the contract that they have. If they are contracted or engaged through a private sector, then these access to these equipment is further less. So these are certain, so based on their nature of contract, the procedure of work that they entail, that they adopt, their vulnerability also sort of escalates, right? So there have been these numerous enumeration that the state government and the national government have undertaken. For instance, there have been 7 national level surveys that have been undertaken so far, and still there is no consensus from these national departments on the number of sanitation workers or the manual scavengers that exist. So these are some glaring questions.
Yeah. Could you point me to some documents which right now you mentioned, like categorically differentiate between the
so if you read the manual scavenging law, right, the act, both the 1993 act as well as the 2013 act, right, they especially the 2013 act, it has it sort of differentiates between, say, sanitation workers and manual scavengers. So there is a clear definition between the two, and the state is sort of trying to create these categories which state as if it's mutually exclusive, and then trying the Garima scheme that is launched in, say, Odisha. It refers to core sanitation workers. It's an interesting scheme in the sense, like, it has made a lot of progress in terms of offering social protection to sanitation workers, but these are only for core sanitation workers. Those who are engaged in like highly skilled sanitation work, which may also involve mechanical cleaning of sewers, septic tanks, but with protective gear. So a lot of social protection that is being offered to these workers. So there are these different types of categories of workers that the government, even the state as well as the national state, like in terms of Odisha state that has come up with this scheme, they're trying to sort of come up with these categories to differentiate it from manual scavengers.
Thank you.
Thanks, Pruva, for prompting this discussion in India, and I think it's very similar to other contexts, unfortunately. We are coming to an end for this for this morning / afternoon if you're not in the UK session. Thanks a lot for our panelists. It was a pleasure talking to you and hearing about your work. Yes, so received nice feedback on the HOVA application for our panelists. So thanks again. And yeah, to sum up, it's that the COVID-19 remains a challenge, not just for our regular daily life, but also to sanitation workers who face further uncertainties added to their current or their previous uncertainties before the pandemic. Thanks a lot for joining us today. Thanks for Maryam and Pruva, my colleague. This meeting or this session will be recorded and uploaded to HOVA application, and also will be sending a summary blog for each day so that you can read if you missed some of the thematic sessions. Thanks a lot. I will finish at this point. Thank you.